Hi everyone, I'm Carmel Tebbett, the CEO of the Mental Health Coordinating Council. Welcome to our webinar series on the agencies, programs and processes that form the mental health system in New South Wales. I'd like to begin by acknowledging the traditional owners of the land on which we stand. For me, that's the Gadigal people of the Eora Nation, but it will be different depending on where you're zooming in from. And I would like to pay my respects to elders past, present and emerging. I'd also like to acknowledge people with a lived experience of mental health conditions and acknowledge their contribution to our mental health service system. Thank you for all that you do. This event is the first of our sector development webinar series, and we hope that what you hear today will help you better support those that you work with, navigate what is a very complex mental health service system. We're very fortunate today to have two experts from the Healthcare Complaints Commission, Jane Probert and Jenny Wright, and they're going to tell us about the work of the Commission. Jane Probert is Director, Resolutions and Customer Engagement and is a lawyer and mediator. Prior to joining the Commission, Jane held the role of Director of Dispute Resolution Services in the State Insurance Regulatory Authority. And Jenny is Engagement Officer at the Commission, and prior to that was involved or worked in medical education at the Royal Australasian College of Physicians. After their presentation, we're going to have Natasha Jones, who is a senior peer worker with Flourish Australia, ask some questions, and we'll also have questions from the audience. There'll also be time for you to ask your questions. So please, as the presentation is underway, log your questions in the chat function and then we can return to those at the end of the presentation. So thanks again for joining us. I'm now going to hand over to Jane and Jenny to start their presentation. Thanks very much, Jane and Jenny.
Hi everybody, I'm Jane and this is Jen. We just want to thank you firstly for having us here today to give this presentation. The Healthcare Complaints Commission is responsible for managing healthcare complaints in New South Wales. It's an independent organisation that has at its head the Commissioner, Sue Dawson. She's independently appointed by Parliament, and we don't report to the Ministry of Health. We report to the Parliament, to the Joint Parliamentary Committee on Healthcare Complaints. So what do we manage healthcare complaints about? We manage healthcare complaints about health organisations, and health organisations are things such as private and public hospitals, medical centres, dentists, physiotherapy practices, even some nursing homes. For example, we manage complaints about registered health practitioners. Now, registered health practitioners are practitioners that are registered by the Australian Health Practitioners Registration Agency, or otherwise known as AHPRA. There are 15 professions which are registered. So they're professions such as doctors, nurses, dentists, and the like. And then we look after the unregistered health practitioners. Now this is a little bit more vague in real terms. Now, unregistered health practitioners are those health practitioners that are not listed under AHPRA. So they will include counsellors, speech pathologists, audiologists, naturopaths, massage therapists, some, in fact, beauty clinics that do some more medical work, Reiki physicians in some occasions, Reiki practitioners. They're all unregistered health practitioners. The jurisdiction is the provision of healthcare service. And we have to look at those, particularly for unregistered health practitioners, on a case-by-case basis. Now, I'm going to give you an example of that. A community worker who visits a client, who just takes them shopping or helps them clean the house, may not be providing a healthcare service. But if that same person actually provides them with medications, then that very well may be a health service. So it's a very fine line in occasions what we can classify and we have to look at on a case-by-case basis. So the next slide is, sorry, I can't see my slides properly. What type of complaints do we manage? We manage complaints about clinical care and treatment provided to a person and the professional conduct of a health practitioner. You may ask whether this is actually, what's the difference? Clinical care and treatment is very clear. It's about the provision of a health service in terms of prescribing medication or doing some physio treatment for the individual. That's clinical care and treatment. Professional conduct may be the fact that a carer who looks after an individual, providing them with medication and proper care, goes in there and into their home, into a person's home, and steals their credit card. By doing that, there is a conduct that is not professional. Professional conduct can also be inappropriate relationships that the provider of the health service begins a personal relationship with the individual, and many of our complaints are in relation to boundary violations, such as having a relationship or a sexual relationship with the person that they're providing the service to. So they're that's the difference in the complaints we manage. Sorry. Apologies. Concerns about healthcare, what do we do first? We always try and suggest to people that they should actually, if they've got an issue with the provision of a health service, that they should speak to the health or support service initially. So if you go to a medical practitioner, your best place to actually raise your concern with that medical practitioner first. That is, of course, unless you don't feel that you can, and then it could be to the GP practice, because it may be about some provision of the service that they're doing. And we do know that in many cases, the concerns can be dealt with by the service provider at the time. And that is always the best way to do it. That said, however, if you can't resolve your complaint or your concerns directly, that's not a problem. We can deal with it directly here. So if you don't feel confident that the practitioner or the service provider is going to assist you in resolving your issues, you can come to the Commission straight away. Okay.
Moving on, thank you. So we actually do, I'm Jen, by the way, and thank you so much for being here today. If somebody approaches you and they've got some concerns about their healthcare, as Jane just mentioned, it can be really helpful to resolve, to raise those concerns locally in the first instance. But we understand as well that, if you haven't done that before, you might not be sure about the best way to go about raising those concerns locally with the practitioner. And so we do have some information on our website under our Understanding Complaints tab that does provide some information about how you can go around raising concerns either directly with the practitioner or with the hospital or the practice in the first instance. But as Jane said before, if that's not appropriate, if you don't feel comfortable, of course you can also raise your concerns directly with the Commission as well.
So,
and so in terms of making a complaint, so any person can make a complaint to the Commission. So the person that actually received the health service can come to us and make a complaint, but also a parent or a guardian, a relative, a friend, a representative, a health service provider that's noticed something that they don't feel quite right about, or any other concerned person can actually lodge a complaint with the Commission. And under those circumstances, we, if it's not the actual person that received the service, in many cases we would actually need to have the authority of that person. In order to assess the complaint, we would obviously need to obtain information about what happened, and so we would need that person's authority to go ahead and actually look into the complaint, regarding what had happened.
thanks. So,
there we go.
So how do we make a complaint? Our legislation is very clear that the complaints must be in writing. Now, that said, we've tried to make it as easy as possible. We have an online portal that can be accessed most easily through our website. And all you have to do is, on our website, is click make a complaint, and it will take you directly to that portal, where you just fill a simple form in and it will be automatically sent to us. We can also do it by writing. We do have hard copy forms. If someone hasn't got access to the internet, we are more than happy to do that. Now, in making a complaint, we also have an inquiry service that is happy to take any inquiries and to help assist in filling out the complaint form for you. Or we can take the complaint over the phone and make sure that we have everything that we need from there. So we try very hard to become to get complaints as easily as possible. It just has to be in writing. We support our website supports people whose English is second language. We have multiple translation on our website that we translated into numerous languages. We also have interpreter services that we use. So that's if anybody does need an interpreter, or puts in a written complaint in their language, we can actually we get it translated for them and deal with it that way. If people want to speak to a case manager, then again we use interpreter services to be able to assist us with that. So there are many ways in which you can make a complaint.
Yeah, so in terms of if someone had approached you and they had something that they were concerned about, they were thinking about making a complaint to the Commission, we do suggest that before sort of jumping onto the portal or contacting the Commission, it's a really good idea just to capture a little bit of information that would actually help us to understand the issues that are involved in the complaint and to understand what happened, so that we're best placed to work out what to do next. So if putting in a complaint to the Commission, it's a really good idea if people, and probably quite soon after the incident, because we all know that, after a bit of time, memory can fade and it might be difficult to remember the name of a person involved or exactly what happened. So quite soon after the incident, to sort of jot down what happened, where and when that occurred, and a little bit more information around that, so that when you actually lodge your complaint, that the portal itself will actually prompt all of these kinds of questions. But having that information available when you sit down to make the complaint can be really helpful. Corinne, it looks like we might have lost our slides at this end. I'm sorry.
Yes, we're just trying to get them back.
Okay, thank you.
There they are.
Beautiful. Oh, that's wonderful. Yeah, so who was involved? And if you had, I think as we mentioned earlier, it can be a good idea to raise things locally in the first instance and see whether or not that's something that might be able to be sorted out. But if you have sort of raised it and, you weren't able to get a response or it wasn't what you expected, just having a little bit of information, that you had raised it and what the outcome of that was. And if there's any records or additional information that might be helpful. And the other thing I think to think about is, what is it that you'd like to see as an outcome of the complaint? So, for some people that might be, I just don't want that to happen to anybody else, or I just want to make sure that the next time I'm in that situation, that same thing doesn't occur again, so I can feel safe. So there can be lots of different reasons that people wish to make a complaint, and it's really helpful for the Commission to understand actually what people would like to see as an outcome when they do make a complaint with us. And that also helps us with our communication and being nice and clear with people. If we phone and acknowledge that we've received the complaint, we can have a look at the information there and explain some things we might be able to achieve, and there are other things that we might not be able to achieve. So it's good for us to have a good understanding of that as well. Next slide, thank you. So this is one of the things that we really do like to point out to people, because we understand that when you make a complaint, of course, you're anxious and you're waiting to hear back, and that can be quite a stressful experience for somebody who does have a concern. But it does actually take a little bit of time for us to assess a complaint. And that's because really, when we say assess, it's almost like a preliminary investigation. So we really do need, we're gathering the information that the person who has the concern has put into us. And then we'd have to gather information from the provider to find out, what their response to those concerns are. In many cases, we need to obtain the medical records and to go through those to see if we can identify any issues or concerns. If the complaint is about a registered health practitioner, so as Jane mentioned before, there are 15 registered health professions. So doctors, nurses, chiropractors, dentists, occupational therapists, physiotherapists, Chinese medicine practitioners. There's 15 professions that are actually, if you work in that profession, you must be registered with the Australian Health Practitioner Regulation Agency. So, and you can actually go onto the AHPRA website and look up any registered practitioner to see, that they do appear on the register. So your dentist, your doctor, your nurse, they will all appear on that register if they are practicing in the registered health professions. So with complaints that are about registered health professionals, such as doctors and nurses, we may need to consult with the Health Professional Council. So for example, if the complaint is about a medical practitioner, or a doctor, we need to consult with the Medical Council of New South Wales. If the complaint is about a nurse, we need to consult with the Nursing and Midwifery Council. And it's a co-regulation, which means that we're obviously the complaints handling agency. The Health Professional Council has the knowledge of the profession, to be able to identify if there are departures or concerns. And so we work together to assess complaints about registered health practitioners. And of course, all of this can take some time. So that's why it can take about 60 days for us to finish the assessment of a complaint. And then potentially it might be another sort of 7 to 14 days from there before you actually receive a letter or an outcome for us. Because once we've done the assessment, of course, we then need to write letters and communicate and explain how we reach the decision that we have. I did notice a wee pop-up come up there. Thank you so much for the question. I think it was about what happens with unregistered health practitioners. So with unregistered health practitioners, that there aren't sort of councils. So if it's about, for example, a naturopath, because they're not a registered health practitioner, the Commission actually has powers to assess those complaints, to obtain information and to make decisions about any action that's required in regards to the unregistered health professions. So that's how that works. I hope that's covered everything. So then we get to the outcome stage, and so we always let people know what the outcome of their complaint is. So absolutely you'll receive a decision, and what we do is we would write a letter and either email that or post that to the person that made the complaint, depending on the way that they prefer to receive communication. Sometimes the person might not be happy with the outcome that the Commission has reached. In many cases, perhaps since the complaint was submitted, there might be some more information that's come to light, or the person might feel that we actually missed an important issue when we were assessing the complaint. So the Commission also has a review process. So if somebody receives an outcome from the Commission and they feel that we've missed something or there's additional information available, they can come back and they can ask the Commission to review it. We ask that those requests be lodged within 28 days. But if there's a reasonable reason that a review request is lodged at a later date, we'd consider that as well.
So what are we unable to do? We can't force a practitioner to see a person. So we can't say to the practitioner that your relationship may have broken down with a person who they were seeing. We can't force them to do that. We can't deal with refunds or fee reductions, although sometimes we are able to negotiate something with the parties, but that's not our place. We aren't in a position to award damages and compensation for anyone. That is a matter for civil litigation if needs be, but we can't assist with that. And one of the big complaints areas that we get is that people want medical records to be changed because they're unhappy with what's in their medical record. We can't direct medical records to be changed in any way, shape or form. So what we can do, however, is we can suggest ways of being able to, we can suggest ways to assist the person to have those medical records changed or reflected. So what that means is one of our major suggestions is that you can actually write to the medical practitioner and ask them yourself to amend the medical record. If they don't do that, the suggestion is that you can actually ask the hospital or the practitioner to attach a letter to the medical records that raises the concerns that the person may have, so that it is actually on the record. However, there are rules, very strict rules in relation to changing medical records in hospitals. So that's the main reason for that. And the other alternative that people have is we will direct them to the Information Privacy Commissioner, who will be able to look into the issues and assist them.
And I think as well on that point, Carmel, you mentioned before that it can be sometimes quite a tricky system to navigate. And there are often, quite a lot of different agencies that deal with different kinds of complaints. And so, for example, the example that Jane's just spoken to then in regards to the Information and Privacy Commission, they would actually consider complaints about people who have concerns that there are inaccuracies in their medical records, or they're unable to obtain their medical records, or they wish to include a letter, as Jane suggested, into their medical record to, explain that they actually disagree with a diagnosis or information that might be held in that record. The Information and Privacy Commission is actually the body that would manage those kinds of complaints. So as Jane said, quite often we might sort of give people some advice about how they can go about it, but we would probably also direct them to the correct information, which in this case would be the Information and Privacy Commission. And I think this speaks back to what Jane was saying before about our inquiry line. We have a person that you can talk to. So we have people on the inquiry line. They work Monday to Friday from 9 till 5. you can contact them. You can actually speak to a person if you're not quite sure whether, is this the complaint you help with, or am I coming to the right place? Our inquiry officers are very well informed and, you know, very happy to help navigate people to the right place if we're not the body that's best placed to manage that complaint. And in many cases, perhaps there might be something in that complaint that indeed the Commission would like to look into, but there might be other elements of that complaint that another body might be better placed to look at. So we understand that it's complex, and please, you know, when you're working with people, they're most welcome to contact us on the inquiry line if they just wanted to get a little bit more information. And it looks like our slides moved, which is great news, because, you know, obviously we've talked about sort of the process of lodging a complaint and the way that we would communicate with people about a complaint, and how long it might take to assess a complaint. And I think one of the things that people, you know, like to understand is, well, what might happen as a result of the complaint that I've made? And so what we wanted to do was just to talk through some possible complaint outcomes. And so this first slide here, one of the things that we can do is, if a complaint raises, you know, significant issues, so that would be, look, there's a significant risk to public health and safety here. There's been significant departures from what we would consider to be acceptable standards of care and treatment. So, you know, perhaps during the assessment stage, we have gone and got some advice from a peer, some clinical advice from a peer. They might be quite concerned. If there are significant issues there, we may decide that we would investigate the complaint. And so what would happen then is the complaint would move from assessments, it would move to our investigation team, and they would be obtaining more information and looking more closely at the issues that have been raised in the initial assessment to determine whether there's anything else that we need to do. So, you know, not all complaints are going to be investigated. Our assessment is an initial and very thorough and robust look at the issues that are raised in the complaint, but only if there's something substantial and significant there would it be referred to investigation. And at the bottom there, we've got a little bit of information. So in 2018-19, in that full year, we received about 7,300 complaints and we commenced 407 investigations.
And then if an investigation finds there has been significant risks to public health and safety, or significant departures, or significant issues, these matters will then be referred to our
Director of
Proceedings, who is our head lawyer in the organisation. For then we will prosecute the individual in NCAT. So that's the New South Wales Civil and Administrative Tribunal. And the outcomes for those can be that a person will no longer be able to practice, is one of them, or practice with particular conditions placed on their practice. So that happens in very rare occasions. It's about, it was about 100 recently that we might actually prosecute that way.
So I guess that then leaves, you know, there's still a large volume of complaints there, and people understandably would like to, you know, well, what else might happen as a result of complaints. So, you know, obviously those significant and serious complaints, we have an avenue there for managing those. But sometimes, look, complaints might raise some issues, but they're not going to meet that threshold for us to conduct an investigation. It doesn't mean that everything went perfectly. And potentially, though, there's opportunities there to actually resolve the complaint for the person. And in resolving the complaint for the person, that may actually encourage the practitioner or the health service to then look at, well, what led to this, and is there anything we can do to improve our service so that we're actually making it better for future patients. And so one of the things that, well, Jane is the Director of Resolution and Customer Engagement, and obviously as stakeholder engagement, this is something that's really close to our hearts, and that the Commission does some really excellent work in helping people to have their complaints resolved. So some of the ways that can happen, sometimes during our actual assessment of a complaint, we might reach a resolution. So for example, we might get a complaint from somebody who's, you know, quite upset because they've gone to see their practitioner, they've been kept waiting, you know, for a long time because the person's running late. and, and then when they get to their appointment, they feel, it was a bit rushed, and, they didn't receive an apology and they didn't feel respected in that situation. That's not an ideal situation. And so in assessment, we would contact the provider and say, can you tell us a little bit about what's happened to you? And that provider might come back and say, my gosh, I had no idea that I had actually had that impact on that person. It was a really busy day. I certainly didn't intend to make them feel that way. I'd be very, very happy to give them a call and have a chat with them and reschedule their appointment if they don't feel that they got to raise the issues with me that they wanted to. And so at that point, our assessment officer here might go back to the complainant and say, look, I've just spoken with the provider. They're very apologetic and they didn't realise that made you feel that way. They'd really be keen to have a chat with you and potentially reschedule your appointment. Are you open to that conversation? And if the person says yes, and the practitioner and the person get to have a conversation, they work it out, we'll go back to the complainant and say, is everything okay? Yes, I'm happy. I've spoken to the practitioner. It's a bit of a misunderstanding. I've rescheduled my appointment. I don't feel that I need to take the complaint any further. So that's, I guess, an example of a way that our assessment officer might be able to support the parties to resolve the complaint at that initial assessment stage.
So then we have local resolution, and local resolution usually occurs with a hospital or an LHD or a medical practice, for example, where we actually negotiate with the hospital, and I'll use hospital as an example, and we'll say we send the complaint back to the hospital to manage the outcome. Usually it's in relation to forms of treatment and making sure that the treatment of the individual is maintained. So the local hospital is the place that should be able to remedy whatever concerns that individual may have. Assisted resolution is a little different. Assisted resolution, we have resolution officers who have, some are trained mediators, some they certainly have training in how to resolve disputes. Now, these are usually the most sensitive of matters. Many of them relate to a death in, say, a hospital, and try to build understanding about what went wrong during the course of the treatment that was being undertaken by an individual. It's a lot of families use assisted resolution to be able to understand what happened and why the outcome was the way it was. It is also a very, very good opportunity for systemic facility change, where we find that throughout an assisted resolution, we may find that some of the processes in a particular area are not sufficient, or they hadn't been followed. And we've had some very good results with facilities actually changing their processes due to assisted resolution, so events don't happen in the future that may have caused the issue. Assisted resolution is a voluntary process, so both parties must agree to it, otherwise it won't be able to go ahead. It's a very powerful resolution because it empowers people to understand better and to rebuild relationships, which is one of our things.
And another possible outcome, and I think we sort of touched on this before when we said sometimes we receive complaints that we don't actually legislatively have the power to manage, and they might best belong somewhere else. So sometimes when we receive a complaint, we might feel that, look, this seems to raise an issue. There's some information here that it's probably appropriate that is actually looked at and dealt with by the right organisation. And so in some cases, we'll actually write to that other organisation and we'll refer the complaint to them for them to have a look at. So that's another thing that can happen with complaints as well. And then, of course, there are complaints that the Commission will discontinue. And so sometimes, as I said, it might not be in our jurisdiction and there might not be enough information there for us to actually formally refer that to another body. We may suggest to the person that they'd like to raise it with the correct body themselves. But obviously, if it's not something the Commission can deal with, we would have to discontinue that complaint. Sometimes we'll get complaints and that they might be about, an issue that's not a serious issue. So, I mean, this isn't an actual example, it's fictional, but for example, if someone wasn't happy that their doctor was wearing jeans or something along those lines, it's not a complaint that the Commission is going to be able to actually do anything additional with. And so that's the kind of complaint that we might discontinue. But then I think the more tricky area here is, look, we, as part of that assessment, we gather a lot of information and we look at that information very carefully. We have clinical advisors that can look at that information as well. And so sometimes we gather everything together. And when we look at everything, we don't identify that there's been a departure from acceptable standards. And so in those cases, unfortunately, there isn't really anything more that the Commission's able to do. And so we would need to discontinue that complaint. But it doesn't mean that the complaint isn't valuable. I think, where that person genuinely in good faith has made a complaint, they feel that there's an issue, the Commission's assessed it, we've maybe been able to give a little bit more information about why we're unable to continue or take further action on that particular complaint. But in many cases, that practitioner will still reflect on that. There might be some learnings that come from that complaint for that person as well. So, all complaints that are made in good faith, they are valuable, even if the Commission decides that we're not placed to take further action. And I think that's a really important thing for people to understand.
The Commission also, on occasion, will make comments to the practitioner. And by that I mean, we actually will discontinue the complaint, but with making comments. And their comments are in relation to possibly bad record keeping, or that they should do some, it's suggested that they do more training in some particular module that might be the issue that has been complained about. So we do discontinue with comments, which is that one step more serious than just to discontinue. As Jen said, when we discontinue a matter, we do take every matter seriously. We do look at everything, but sometimes it just it doesn't reach the threshold for further action. And we keep a record of every complaint. So there is, we do know if there are frequent flyers. And that does have an impact. So if you need assistance, call the inquiry line. They can help with anything. The phone number's there. We have a website. The website's recently been revamped. We actually think it's quite a good website now. The other one was archaic. So if you've got any feedback in relation to our website, we would love to hear it too, please. But there's a lot of good information on there.
And I think as well, the other point, which I actually meant to raise before, but I know that the Mental Health Rights Manual that's been developed by the Coordinating Council, it's an excellent resource. Understandably, things can be difficult to navigate, and certainly, I've looked through that and I found it to be really, really helpful in my role here. I'm absolutely certain that people would find this to be a great resource. I believe that it's in the process. There's some updates that might be occurring at the moment, and I'm sure Carmel will speak to those. But yes, that's another, I think, the Mental Health Resource Manual, and also the ability to come to our inquiry line if you have concerns about your healthcare and you're not quite sure where to go, are two really good starting points for people who have concerns. And yes, I think there's probably some questions that are going to come through, but that's the last slide. Thank you so, so much for listening. It's talking into, that hopefully some helpful information and that was shared there that, that you'll find useful.
And we'll certainly share the slides. They're yours for sharing. So there's no issue with that.
Excellent. Thank you so much, Jenny and Jane. That was a really valuable presentation, and judging by the questions that are coming in through the Q&A feed, a lot of interest in what you've had to say, and I'm sure that people will have found it really valuable to hear about how the Healthcare Complaints Commission can both help people but also refer them appropriately potentially to other sources. So yes, we do now have some questions coming from Natasha, as I mentioned at the beginning, and then we will also go to the questions that are coming in through the Q&A feed. But you've already answered one of those, which was, will you share your presentation? So that's great to hear that you will do that, and MHCC will get that around to people after the end of this webinar. So Natasha's now appeared, and I would like to introduce Natasha Jones. As I mentioned at the beginning, Natasha is a senior peer worker for Flourish Australia. Natasha works in the Newcastle Hunter region. She oversees 3 supported independent living properties, so that's working with 9 residents and over 30 staff. And Natasha's got some questions that she's going to pose to Jane and Jenny. I'm going to disappear off screen, and then I'll come back at the end and we will go to whatever questions we can fit in from the Q&A feed. We've got quite a few, so hopefully we'll get a chance to get to those as well. So thanks very much, Natasha. Over to you.
Thank you, Carmel. And thank you, Jenny and Jane. So I have 4 questions today. The first one, in relation to the points raised in slide 4, what if a person's concerns relate to the treatment they have received in a public mental health facility, such as seclusion and restraint? Can the HCCC address such issues?
Yes, absolutely. So if there are issues of seclusion and restraint, they are issues that the Commission considers. So things that happen, you know, medication might be something else, seclusion and restraint, as you've mentioned, access to physical health care, you know, communication about treatment plans. They're all the kinds of issues that the HCCC would consider. I think probably the point to that is that the bit that the HCCC isn't able to look at would be, you know, the decisions that are made by, for example, a tribunal. So we can't look at the decision. You know, for example, someone might not be happy about a community treatment order. So we can't change that. But if there are issues related to medication, you know, someone's concerned that the medication that they have been asked to take is having side effects and they can't seem to get anywhere, then we can look at the medication issue. I hope that helps to explain a little.
Thank you. Yeah. In relation to the points raised in slide 9, what if the person I support has a grievance about another agency, such as the Guardianship Tribunal, the Department of Community and Justice, or the Mental Health Review Tribunal?
With that, we have no jurisdiction over those. So that you would have to follow the complaints procedure for that organisation. Now, in many cases, that will be the Ombudsman. They could go to the Ombudsman, or in other cases, you know, the Guardianship Tribunal. It's the courts.
So I think that's the tricky thing, isn't it? So if a body has made a decision that's a recognised body, for example, the Mental Health Review Tribunal has made a decision, then that body will have its own appeals processes for the decisions that it's made. And so that's not for the Commission to consider those decisions. But certainly decisions about care and treatment, decisions about professional conduct of health practitioners are things that we can look at. So, yeah. And again, inquiry line is always there for people who are not quite sure where, you know, what they want to raise, whether that's something that we can assist with.
Mm-hmm.
Thank you. In relation to slide 11, supposing the person I support wants to raise an issue about a support worker providing a home or psychosocial support service, can the HCCC deal with those complaints?
Yeah, and I think this is where it's such a case-by-case basis, you know, and I know that Jane mentioned to you before, you know, somebody that's going into someone's home and sort of supporting them and doing shopping with them and taking them out. you know, that might not necessarily be a health service. And so if it doesn't involve a health service, then it's not going to fall within the Commission's jurisdiction. But if that same person is helping with sort of therapy, is providing counselling, is providing medication or supporting the person to take their medication, very well that could be considered a health service and would fall to us. And so it's a very difficult question to answer specifically, because it really does depend on the case. But certainly if provision of a health service is involved, that's something that the Commission could consider.
That said, if you think it is, we're happy to look at it. And we do look at them we do investigate quite well to see whether it is a treatment and care issue that we can look after. And we will actually be very clear about why we are not why we can't assist you with the complaint. So it's a very fine line. It's a case-by-case basis. If you've got concerns, it could be just a phone call and we could have a chat.
And then I think as well, that could be that thing about potentially other bodies that might be able to assist with that. So for example, if this is a support service that's been offered through the NDIS, then the NDIS Quality and Safeguards Commission may very well be able to consider those issues. So again, you know, by all means, use our inquiry line if you know, you need a little bit of help to navigate some of those issues.
Sure. And my last question, how can a person be sure that a complaint won't affect access to services at another time?
Yeah, I mean, I think that's such an understandable concern. I think anyone raising a complaint about anything, that's something that I can completely understand that people would have those concerns. I think from the Commission's perspective, we do a lot of work. So in addition to what we saw with resolving health concerns and how people who want to raise concerns can go about framing those concerns and putting things together in a way that's more likely to help them get at least some answers. We also go out and we educate practitioners as well. So we also encourage practitioners that they need to have systems and policies in place that welcome complaints, that it actually can be really nerve-wracking to raise a complaint. It can be a very difficult thing for someone to do. And it's really important for practitioners to, you know, reassure the people that they're working with that, you know, complaints are welcome, that feedback's welcome, and being able to address those things. So from the Commission's perspective, we do work with practitioners. We go out, we talk to hospitals, we talk to health services about, you know, how you can welcome complaints and how you can communicate with people and potentially sort issues out earlier, so that, you know, if it's a simple thing, if it's around communication, if there's not a big clinical issue, is this something that would be avoidable, and is this something that really good communication could actually sort the problem out and also make that person feel reassured and trust that they can access that health service. So I think it's a valid thing to raise, but I think you know, most local health districts, they have excellent, really robust complaint processes in place. They often have a patient liaison person, they have a complaints manager. Those people are actually really skilled and they want to hear the complaint. They actually want to improve their health service. And, you know, we do find that that's the case. So, you know, I think to be reassured that it's okay to raise the complaint, and you know, and that's certainly really important.
Individual on case-by-case basis as well. If someone is feeling that they're not getting access, for example, they may be presenting to a hospital and in a heightened state, and there's security issues around them and they're feeling as if they're not being able to get access to the treatment because of, say, the aggression that might be presenting. We have been known with complainants to broker conversations with the hospitals to ensure that the appropriate treatment is being provided to them under agreement. That we do broker an agreement with the parties to ensure that we are able to, they're able to get access to their care. It's the most important thing, that people continue to get access to the appropriate care that they need. We do that in Justice Health as well. So we are very conscious of the need to ensure the continuity of care.
And I think as well, with the, registered health professions, there's codes of conduct, there's ethics. People need to be able to respond to feedback and to help people understand the care that they're receiving and to explain things to them. It doesn't mean the answer's always going to be what's necessarily wanted, but certainly, people need to feel confident about raising issues. And that's how, standards of care are improved. If there's no feedback, then, that person might not even realise that they didn't communicate about that issue well. So, yeah, hope that helps.
Great. Thanks very much.
I've just seen a question from Corin, just a quick one. Can people in corrections make complaints to the HCCC? Absolutely. Absolutely they can. And we respond as rapidly as possible.
Yeah, so I think in the correction system, on the phone system, there's a number to dial that actually takes you straight through to Justice Health. So if locally you don't feel that you've got access to treatment or care, or there's an issue around getting an appointment, you can go straight through to Justice Health and raise that concern. If Justice Health isn't able to assist you to sort that out, then there's another number that you can dial that brings you through to the Commission, and we'll post forms and whatnot to people so that they have access to make a complaint if they'd like to.
Thank you. Thank you again to Jenny and Jane for those answers. Thank you, Natasha. They were great questions and in fact picked up a number of the questions that have come through from the audience, but there are still a lot of other questions. We've had really great engagement. So such an interesting look behind the scenes almost of how the Commission works, and so important to hear that and for people to understand that. So I'll just try and run through some of these questions. Now, I think you've maybe answered this, but I will still ask it, and that is, would peer workers, mental health peer workers, fit under unregistered health practitioners?
Again, I think that probably goes back to that case by case thing, and is the person providing a health service? So, I think in a situation like that, we'd have to look potentially, and certainly I think if there's, I'm not 100% sure how different that role is and for different people that you work with and different spaces that you work. So I don't think we could say no straight out. I think we'd have to look at what the issue was and whether that involved
and what care that they're providing
of a health service, at that stage.
Yes, thank you. So another question is, are complaints different to mandatory notifications made to AHPRA, like in the boundary violation example you gave?
Yes and no. Mandatory violations, no. Mandatory reporting comes to us. They go to AHPRA and they get sent to us to deal with.
It's a specific thing in New South Wales. So, medical practitioners across Australia, they're required to make a mandatory notification, under certain circumstances. And in New South Wales, in addition to that mandatory notification being made to AHPRA, AHPRA will also pass that information to the Healthcare Complaints
Commission. Due to the
Commission
co-regulatory nature of our operation.
Yeah. So yes, the right place to go for that is AHPRA, but AHPRA will actually send that information to us to look at as a complaint as well.
It is a complex system. That's why webinars such as this are so important. Look, another question is, are there mechanisms for cross-checking if a practitioner has multiple complaints?
Yes.
Oh, yeah. So it's considered. So I think it's, obviously, if there have been issues that have been raised, previously, then that information will be looked at as part of the overall assessment of a complaint.
We look at prior history. We look at the types of complaints that might have happened previously in relation to the individual provider. If there is a pattern about it, about their behaviours, that will have an impact on how we might deal with the complaint or ultimately investigation.
Thank you. And then another question which I think would be of interest, is the practitioner given the name of the complainant? I think you've probably covered this in your process, but
I think people can make a complaint confidentially. So they can, go onto the website, you can make a confidential complaint. You don't have to give your details. But the problem with that is if we can't follow up, so if we can't, you know, look at the records, if we can't ask the provider to give us a response to what happened, then it's going to be probably quite difficult for us to actually take that issue any further. So, I mean, it can be done. And obviously that would still be, I guess, it would come in and that be information that we would look at, and depending on what it was, would, again, it's this case by case thing. But in order to properly assess the complaint, generally we would need to give the provider an opportunity to respond to the concern, and then we would need to sort of obtain the right information so that we can look at everything independently and impartially to decide the best course of action. And that could be quite difficult where we're unable to clarify those details with the provider at the other end.
So we've got time for one more question, if that's okay with Jane and Jenny. And this one is, does departure from acceptable standards, which I think is something you referred to earlier in your presentation, does this imply that the Healthcare Complaints Commission is service provider centric, or looks at things from the lens of the practitioner more so?
No, I think it's, you know, in terms of the work that we do here, you know, we've got to consider, you know, what would an acceptable standard of practice be in that situation, in that profession. And I know that I mentioned before that we have access to be able to get clinical advice on matters. And I think, you know, we need to remember that medical practitioners and nursing practitioners, you know, people go into these professions, they want to see their profession is well represented, and they want to make sure that people are safe, you know. And so I don't think that's the case. I think that you know, those standards that are set, you know, there are acceptable standards of clinical care and treatment, there's acceptable standards of professional behaviour, and, you know, they're the standards that would apply if you were looking at whether or not something, you know, had departed from what was an acceptable standard.
Okay, I think that's probably all we've got time for now. Look, thank you so much to Jane and to Jenny, our presenters. Thank you very much, Natasha, for those excellent questions. Thanks to our audience. We've had really good engagement, participation. This is clearly an area, I think, of great interest and importance for people who are working in the mental health sector. I want to thank Corinne Henderson, our Principal Policy Advisor, for whom put this together, and it was her idea for this webinar series. So thanks, Corinne. I think this has been a fantastic start. As I said at the beginning, this is the first of our series of webinars. So the next one will be in early December, and we're going to be looking at the role of primary health networks and how they interface with the mental health service system. And you will be provided with the details of that in the near future. We'll also be sending you a short evaluation after the event. So please, if you can complete that evaluation, it helps us know if we're on the right track or if there's things we need to change. And we will distribute the slides, which Jane and Jenny have so kindly said will be available, because I know that will be really helpful for people as well. So that's it from me. Thanks again to everyone for joining us. Thanks again to Jenny, Jane and Natasha, and have a good day. See you later.
Thank you, everybody. Thanks.
Bye.
Bye-bye.